we need to maintain some of the provisions that are expiring under the American Recovery and Reinvestment Act, the so-called stimulus, and that's the child tax credit and the earned income tax credit. The austerity, Mr. Scott, that we're trying to avoid is that children bear the burden of this recession. They are often hidden faces. They don't vote. They don't contribute to campaigns. But we thought, the Congressional Black Caucus thought it was really important to put on the table the need to protect children. Again, we don't think Social Security should be on the table in these fiscal cliff discussions. It's not the driver of the deficits, and further down the line, we think it's important to mess with the age or switch to the chain CPI or any other cuts that would affect beneficiaries.
Will the gentlelady yield?
I will yield.
People talk about increasing the age of Social Security or the cost of living increase. The first question is whether or not you're going to cut Social Security. And then if you decide to cut Social Security, there are different ways of doing it, some more painful than others. But the first question is, are you cutting Social Security? But part of that question is why. If none of the tax cuts get extended, at this point you've got too much money. You've got more money than you need on the table. And so the only reason you're even discussing a cut in Social Security is because you want to extend the tax cut. Now, I think most people, when they're faced with the choice, do you want Social Security to be a piggy bank every time we're running short in a budget? Some of you are going to cut a little Social Security or Medicare or Medicaid. Or are you going to make that a little piggy bank every time you have a budget problem? And if you're going to extend tax cuts, how are you going to pay for them out of Social Security? I think most people would want us to leave Social Security, Medicare, and Medicaid alone. Leave it alone. And if you got enough money for tax cuts, fine. But do not extend tax cuts and think you're going to pay for it and people are going to like you paying for it out of Social Security and Medicare. And that's really the choice we have, because the entire discussion about Medicare is only necessitated by the fact that people are trying to extend these tax cuts. And if you extend the tax cuts, then you have to pay for it. And we're talking arithmetic. And if you extend massive trillions of dollars in tax cuts, the only place you can reasonably get it, Social Security and Medicare, unless you're going to raise some other taxes to offset it. And the Congressional Black Caucus has taken the position that we don't want any tax cuts that are paid for. If you got to cut Social Security, Medicare, Medicaid, the social safety net, or investments in our future like education and research, infrastructure. We don't need tax cuts that badly. We need those investments more than we need tax cuts. And so when you start talking about the different ways of cutting Social Security, we need to make sure that it's in the context, that we're talking about cutting Social Security in order to preserve the tax cuts.
Let me ask you something about preserving the tax cuts. The president campaigned for a couple of years, but particularly in the last year, on cutting tax cuts for income over $250,000. So am I to understand, Mr. Scott, that means that millionaires and billionaires will still be getting a tax cut were they to agree to this framework?
They would get a tax cut on their income up to $250,000. Their income over $250,000, they would not enjoy the Bush-era tax cuts. They would be paying the same taxes they were paying when the stock market was under the Clinton administration, when the stock market almost quadrupled. The Dow Jones Industrial Average almost quadrupled. Under the lower tax rates, under the Bush administration, the Dow Jones Industrial Average was incredibly worse at the end of the 8 years than it was at the beginning. Quadrupling under Clinton, worse under Bush than it was at the beginning. Of course, job creation records under the Clinton administration, when you had the higher rate. Under the Bush administration, the only measure you're looking at is it or is it not the worst since the Great Depression. Obviously, those who are paying the high rate actually have more of a financial interest in the stock market, because the little bit of tax increase we're talking about, they will more than offset that by the stock market going up. like it did under the Clinton administration. If you look at the taxes, they save what they if they could have gotten the returns on the stock market under Clinton, they would have gotten about 10 to 20 times more returns in the stock market than they paid in the little taxes.
So we have heard some people panicking, saying, boy, between me and my husband, our household, we make $252,000 a year. Um, what do we say to someone, a family earning $252,000 a year, that you're going to pay the higher tax rates on $2,000 of your income?
You're exactly right. It probably would not result in any change in the withholding because it's that little bit of money, and they would have all the tax cuts up to the first 250,000, and they would pay a slightly additional tax on the additional 2,000. And one of the things we need to point out is with the stagnant economy, most workers haven't gotten a cost of living increase in a long time. If we can improve the economy, if we had a little more money and could create jobs, improve the economy, such that employers think that people might actually walk off the job and go get another job, they are more likely to get a cost of living increase. That cost of living increase is more than the additional taxes we're talking about in most cases.
Thank you, Mr. Scott. You know, I have many, many questions for you. About what the options are, about what we can do, and I know that the Congressional Black Caucus doesn't agree on everything, but it seems to me that the Congressional Black Caucus is very concerned about the math adding up.
Well, and that's exactly the problem. When you start talking about reducing the size of government with unspecified cuts, or revenue increases that do not rate increases, but revenue increases, whatever that means, without specifying. We don't even know whether it's arithmetically possible, but if it is arithmetically possible, what we suspect is it's going into things like the deduction you get on health care. Don't have to pay, if you get health care insurance, you don't have to pay income tax on that. You don't have to, the mortgage deduction, charitable deductions. I mean, the kinds of things that we probably wouldn't want to cut in order to fund some tax cuts. But the Congressional Black Caucus did talked about deferral of overseas corporate profits. If you eliminate that exemption, that's about $500 billion. 5% surcharge on millionaires, that's about $500 billion. Financial speculation tax, when you buy stocks and trade stocks and bonds, pay a little 1/4% charge on that. Now, before the discount brokers, people would be paying 1 or 2%, not just a little 1/4%. So that's certainly something that could be done. Limit the deductibility of corporate debt interest. That's about 3/4 trillion. Treating investment income like regular income, that's almost $1 trillion. I mean, there are a lot of things we can do to add up to get to the little bit of money we need left. Negotiating prices on pharmaceuticals under Medicare.
This is exactly where I wanted to go. I wanted to talk about people are very nervous about this discussion of the Republicans continue to say that we need to put Medicare on the table, and you know, I know that during the campaign they talked about creating a voucher, premium support under Medicare, which would have cost seniors an average of $6,000 more.
About $500 a month more for health care than they're paying now. That was the plan.
And how does that differ from possibilities that are available under the CARE Act, under the Affordable Care Act, which is really ironic because if you want to derive some savings under Medicare, and I have no reason to believe that Republicans don't want to do that, why would they continue to be talking about not governors all over the country talking about not putting the exchanges together in their states, still some sort of agenda to repeal Medicare? What savings can be derived out of Medicare from full implementation of the Affordable Care Act, so-called Obamacare?
Well, one of the things that Obamacare did was to provide for those on Medicare, you get your annual checkups with no copay in cancer screenings, no copays and deductibles. We're closing the donut hole. And under the Romney plan because they're paying providers more. Your copay part of that provider fee is more, so your copays and deductibles would be more. That's for people over 55. People already on Medicare would pay more under the alternative than they're paying today. If you're under 55, you're at your $500 a month, every month, trying to make your health care. Because the thing is that if Medicare is saving money and the health care costs do not go down, then somebody's got to pay the difference. Adding insult to injury to that, you have corporate profits, dividends, and commissions and everything else being siphoned off. So you not only have to pay the health care costs, you have to pay enough to cover the corporate profits. And so that's where the senior citizens would be paying $500 a month, $6,000 a year.
So, Mr. Scott, let me see if I've got this straight. Under the Affordable Care Act, we are asking that instead seniors pay more, find themselves in the donut hole, that we ask pharmaceutical companies to negotiate drug prices, over 10 years. That might be $156, $57 billion.
There's a provision in the prescriptive drug benefit that passed about a decade ago that prohibits HHS from negotiating drug prices with pharmaceuticals. Now, the VA can negotiate prices. Medicaid can negotiate prices. But somehow, somebody, I don't know who, nobody's taking credit for it, just kind of ended in there, prohibits HHS from negotiating drug prices. So when a company says, this is what we want, it is illegal for HHS to point out that you're charging everybody else less, you charge in Canada less. How about giving us a little savings? That's illegal. Well, whatever they want, that's what they get.
That would be a great reform under entitlement. Another entitlement reform I would just like for you to address that's in the Affordable Care Act would be this so-called Medicare Advantage program. Medicare Advantage, I mean, who doesn't want an advantage? But the actual delivery of the service, to whom does the advantage inure?
Well, the Medicare Advantage gives you slightly enhanced benefits under Medicare, and it was provided by Medicare. And what the private sector says is we could provide those same services for a lower cost. And if you let us get in at 95% of what you're paying, everybody wins because we're saving money. That's a phantom saving, but that was the original deal. By the time in the prescriptive drug benefit, we're paying about 115, something like about 150 more than the average. And all we're doing is saying, well, let's just pay the average. Now, the insurance companies do have an advantage in their costs because there are ways of attracting a healthier clientele. Mm-hmm. So their costs would be lower, not because of efficiency, but because they skewed a better, more healthier clientele, and that's how they save money. But what we did was reduce their profit margin to the point where they have to be at least as efficient as Medicare, not getting a bonus, which didn't help anybody.
So I see, Mr. Scott, that Representative Sheila Jackson Lee has joined us, and so I just want to close out by asking this last question, just to wrap up this. So when the president talks about putting $480 billion of cuts on the table for Medicare, without knowing all of those details, a lot of that depends on not reducing benefits to the elderly, but to make sure that pharmaceutical companies and insurance companies and that hospitals deliver services in a more efficient way, that people, that the delivery of that we change the way health care is delivered in a way that is efficient, more humane, cost-effective, and deliver the same level of quality and benefits to the elderly.
And
that right?
That is exactly what we did. And much has been made of the $716 billion that was saved in Medicare. The corporate subsidies was part of it, efficiencies were part of it, but not a dime in benefits was adverse. In doing that, we also extended the solvency. Medicare was going broke in 4 years. Now it's 12 years. Under the alternative plan during the campaign, it would be back to 4 years. So seniors on Medicare now would be paying more. Younger people, when they get to Medicare, would pay a lot more, and it goes broke quicker. That was what we were fighting, and the president was reelected, and so Medicare will not be attacked. But again, when you talk about additional Medicare cuts, we're just not cutting in the abstract. Those cuts are necessary because people want to extend the Bush-era tax cuts. If you do not extend the tax cuts, you do not have to discuss any cuts in Medicare. These savings are designed to help pay for tax cuts, and people need to make the choice and recognize a choice. Do you want to cut Medicare in order to preserve some tax cuts? I think a lot of people would say leave Medicare alone.
Leave my Medicare alone.
And I'd yield such time as she may consume to the gentlelady from Texas, Sheila Jackson Lee.
It's a delight just to be with you, not a delight on this discussion that we're having. I want to thank the gentlelady from Wisconsin for her leadership and membership on the Budget Committee, and certainly the gentleman from Virginia for their leadership on his leadership on the Budget Committee. And delighted to be a member of the Congressional Black Caucus and have a reasoned discussion and just pick up from where Mr. Scott was saying and just reinforce it. Medicare is solvent. And let me just Medicare is solvent. Medicare is solvent. Medicare is solvent, and it is strong. It is solvent to 2024. Social Security, which is not even an issue, has nothing to do with this deficit. It is a trust fund, but more importantly, it is solvent 2037. Let me repeat myself that Medicare is solvent, Social Security is solvent until 2037. That is really a lifetime, and the gentleman has made a very good point that I would like to pursue in discussing fiscal deadlines. I have washed my mouth out with soap and will no longer yield to terminology that have been used that is falsifying where we are. Let me first go over, and I'm going to mix some apples and oranges a little bit of what the President has offered us. I know we've heard it, but let me reinforce the fact, and my numbers are going to be not precise, but I'm going to say that 1.2, 1.1, over $1 trillion in tax cuts, and then a war dividend, a peace dividend of about $1 trillion. I want to say war, but war savings, and I have signed on to expedite the return of our heroes from Afghanistan, move into the diplomatic process, bring our soldiers home, and $50 billion in infrastructure that creates jobs. For those of you who find sinkholes for your cars, overcrowded on various freeways and highways, this is to aid in doing what we have not done over many decades. It's $50 billion. And then, of course, the mentioned Medicare, and Mr. Scott has indicated that is the President's attempt to be the reasonable man, even though